Hello, my name is Dr. Tony Urbina. I'm a professor of medicine at the Icahn School of Medicine here in New York City, and I'm also the medical director of the HIV and Primary Care Center of Excellence of the New York State Department of Health Clinical Education Initiative. And today I'm going to talk about long-acting injectables for HIV treatment. And as of March of this year, Cabenuva, or intramuscular cabotegravir, and intramuscular rilpivirine have been approved for the treatment of persons living with HIV. So patients often ask me, am I a candidate for these long-acting injectables? And I think we carefully have to select patients for this therapy. For one, the way that they've been approved is only for patients that are currently on treatment and already are virologically suppressed, meaning that they already have an undetectable viral load. So it's for switch therapy. Secondly, patients cannot have pre-existing resistance to either cabotegravir or rilpivirine. So we're talking about patients that have not been through a lot of oral agents, maybe have developed resistance to previous antivirals. So again, no previous resistance to either of these antiviral agents. And thirdly, and most importantly, it's patients that are going to commit to monthly injections. Currently, these injections have to be given in a supervised setting, meaning by a healthcare professional, either a nurse or a provider. And patients have to first start with a switch to an oral lead-in, meaning oral cabotegravir and oral rilpivirine, and they have to do this for 28 days. On the last day of that oral lead-in is when they start with the intramuscular injection dose. So those are two intramuscular, intragluteal injections. And then subsequent to that, patients have to present to the clinic or office monthly for the maintenance injections. So again, patients have a 7-day window either before or after their next monthly injection where they're going to maintain in that therapeutic range. So again, I think patients living with HIV for 10, 20 years or more may have pill fatigue. I also think that sometimes there's stigma and there's psychological distress with, having to be reminded every day that you have HIV, so that this may appeal to patients that basically want a therapy that is an injectable and then they can forget about it. I think also for patients that are traveling, don't want to be concerned about having to take their medications with them on an airport, this may also be a great therapy. So again, intramuscular cabotegravir, intramuscular rilpivirine, known as Cabenuva, is available now for patients. And I think it's a great option and something that a lot of us in the HIV field are very excited about.